Melvin, there's two things you need to learn about fertility. There's two words: time and timing.
If you're trying to get pregnant and it's not happening, most couples assume they just need to try harder, track more, stress more, wait longer. But what most couples miss isn't effort, it's fundamentals. And sometimes you're testing the wrong person first.
40% of couples have difficulty conceiving because of sperm. I need 2 minutes from a doctor.
So before you jump into IVF, before months of testing, let's talk about what actually needs to happen first. Enjoy hearing from Dr. Melvin Thornton. Well, Dr. Thornton, I'm so grateful that you're here. And I am so grateful that we are able to just hear from your expertise. So many people listening feel so overwhelmed by fertility information and are unsure when or even if they should be worried. From your perspective, just right out of the gate, what do you wish people understood sooner about their fertility?
Oh my God, that's an amazing question and the easiest question because I wish let's go back to high school, maybe middle school, when they taught you how not to get pregnant. They taught you about birth control,
Sure.
everything. In schools, they didn't discuss those things, of course, right? But no one ever said, well, this is how you actually get pregnant. I would say about
Right.
30 to 40% of the couples that I see have no idea when they have time sex. They're clueless. They always think the magic day 14, when they have like a 25-day cycle or they have a 30-day cycle.
Mm-hmm.
So I wish the first step is everyone learn their menstrual cycle. Now, Whitney,
Mm.
you remember back in the day, women had a code book that was a calendar. And in that calendar, there were like little red
Yep.
dots, means that you're on your period. And then there were, I can say this,
Yep.
I'm a fertility doctor, but there were little hearts in there. That shit on the heart, that's when they had intercourse, okay? So back then, I can actually see the
Sure.
calendar and I can tell if they're having sex at the right time, okay? But now no one does it anymore. I ask the women outside, what was your last period? They go, I don't remember. Let me check my phone. I say, wait, whoa. Why you gotta check your phone? This is something you have to know. Um, so that's like one of the biggest things that I realized is that a lot of women don't know exactly when they're ovulating and when they have sex. And we're both
You're
frozen
not
right now.
wrong. And it feels like that. Well, it feels like really just the woman's menstrual cycle, despite the fact that we're, in 2026, not a lot of people really know about what is going on in terms of just hormones and, like you said, the ovulation periods and, just all of those things, and wouldn't even know where to start.
Yeah. I mean, I was saying that I'm the kind of doctor that will listen to my patients, and usually what I'm hearing is that A, they're not having intercourse at the right time, or
Hmm.
they're not having frequent intercourse. And the one thing that we talk about the menstrual cycle is that everyone thinks the best day to have sex is day 14, but if your cycle is not a 28-day cycle, that may be too late to have intercourse, maybe too early. And then the other thing is that I always say your body will tell you when you're fertile. And the way it does that is by secreting something called cervical mucus. And I tell them that the reason why your body secretes cervical mucus is because sperm are like guys. We have no idea which way to go or where to go, which way to turn. So the mucus allows the sperm to jump right into it and go right to the cervix and get to where it needs to be without asking for directions. Okay. Um, but when I ask them, when they you check your cervical mucus, they go, what is that? I say, well, in the middle of your cycle, you probably get this moist sensation with a lot of discharge. Oh, yes. Yeah. I say, that's cervical
Sure.
mucus. And that's when you're most fertile. And then the other thing that they don't realize is teach them about biology. And I said, another way your body will tell you that you're ready, you're fertile is that you start secreting testosterone. They go, really? Women secrete
Mhm.
testosterone. I say, yes, you secrete testosterone at the time you're about to ovulate because it makes you more friskier. So you start seeking out your partner, but your body saying,
Sure.
there's an egg coming and I need sperm. And so the testosterone goes up and you start saying, where's my partner? You need to come home early because I feel like I'm in the mood.
There you go,
I'm very
biology.
serious about that. Yeah, that's the way the body works. And many women don't listen to what the body's trying to tell them. When the body said, hey, all the bells and whistles are going off, and they go like, you know, I checked an ovulation kit, but it was negative. I say, ovulation kits are great, but they're man-made. And some of them are very defective. And if your body's saying one thing, the ovulation kit's saying another thing, go with what your body's telling.
Mhm. Mhm. Well, you're right. There's so much outside noise, or there's, shame, or, just all kinds of things that make it where I think a lot of people stop, like you said, they stop listening to their body, and they're going to Dr. Google, and, just all of those things.
Oh,
One one thing that I think is a really big misconception in the world of fertility is that it is just a woman's issue. What do you
yeah.
wish more people understood about male fertility and the role that it plays in family building?
Well, I would say number one is that it takes two to make a baby, just like
Okay.
it takes two to go to a nice to dance. Okay, well, not really need two people to dance, but you need two.
Sure.
And the sperm is very important, and that 40% of couples have difficulty conceiving because of sperm. And this is what I
Wow.
hear. I hear, well, you know what? I want to make sure I'm okay before we check the sperm. I said, no, that's not the way it works. You should both at the same time. So I've seen many women who've gone on medication. Some of them have had surgery. They have multiple examinations done. And they come to see me. I say, well, where's the sperm analysis? They go, oh, I haven't had that done yet. I said, well, your partner needs a sperm analysis. He said, well, I didn't want to get him involved until I knew I was okay. And I said, well, you got to do both at the same time. And for guys out there, women will go through procedures that are uncomfortable. They go through biopsy, they do x-rays, they'll have ultrasounds, they get their blood drawn every other day.
Yeah.
I need 2 minutes from a guy, okay? Some guys not even 2 minutes. But it's like conceive. Well, I got this. I was working late. I don't feel good. I got the flu. Like, come on, just put something in the cup and move on. It's very difficult, but it's one of the most important tests that we do.
Absolutely. For men listening who maybe, just even thinking about this for the first time, what are maybe just some simple proactive steps that they can take early on to either protect or assess their infertility? I know you said it's just a simple, just sperm analysis. Is there anything just maybe lifestyle wise that you feel like is important for men to hear?
Yeah, the most important thing is just to be healthy. Okay,
Yeah.
uh, let's not do anything that can affect our health, such as smoking. Um, Make sure that if you're taking any medications that you talk to your doctor about it. Is this going to affect my fertility, or research and see if it's going to affect your fertility? Part
Mhm.
of being healthy for a lot of people is going to the gym and working out and taking supplements. Make sure the supplements you're taking are not affecting your sperm production.
Mhm.
Um, there's a lot of men who like to take a lot of hot baths, and the worst you can do is to take a hot bath every day because I tell them is that the sperm don't like to be hot. That's why the testicles are outside the body. If you put too much heat there, it's going to decrease the sperm count. So hot baths,
Sure.
hot tubs, those are great every now and then, but not on a daily basis. And boxers are much better than briefs. So if you're a boxer guy, you can deal with. If you're a brief guy, consider changing over the boxers to let the testicles breathe, to let the sperm nice fresh air so they can grow properly.
Yeah, no, that's perfect. But I mean, again, these are such like little things, but like I said, I feel like, and again, I'm sure as you've witnessed, you see all, women are going and having all of these procedures and, and all of these things. And a lot of times, most men don't really think about it until after the fact.
Yeah, it's interesting too. There are a lot of same-sex couples and single men trying to have children, and they've already spent money on certain things. And I say, well, have you done a sperm test? They go, no, I haven't done a sperm test. I said, why are you spending money over here? We got to make sure you have sperm so that you can, have a baby. It's always best to find out sooner than later because if the sperm count's low or there's no sperm, then we can investigate to find out what's going on before we move over to the next step. So, you know, it, it goes back to, I don't know, we have so much technology that we forget the basic stuff. We go to Google, we go to our phone, and Google will never say, first step, get a sperm test done. It will never say that. I'll tell you all these other things that you can do.
Yeah, yeah. And it's surprising that that's not more common with, like you said, 40% of infertility or fertility struggles start, with sperm being, part of it. What what would
Yeah.
you say are maybe some of the most common myths or misconceptions that you see people carrying with them before they ever even walk into your office?
Oh, the common myth is that it's easy for everyone to get pregnant except for me.
Oh
Most
yeah.
people get pregnant. They say, "Got my girlfriend. She had sex one time and got pregnant." Okay, or
Mhm.
her and her partner tried for 2 months and they were pregnant. And I said, you can't listen to that because most people, you have to ask the right question. If they say, "Well, we got pregnant in 2 months," they say, "Well, when's the last time you used birth control?" They may tell you, "Well, we stopped using birth control 8 months ago." But we didn't really try for the last 2 months. But realistically, you've been exposing yourself for 8 months trying to get pregnant. And the
Yeah.
most important thing, the two words that I learned, I always, on my first day of fellowship, I had a great professor. He said, Melvin, there's two things you need to learn about fertility. There's two words, time and timing. It takes time to
Mm.
get pregnant. And the women, as you know, the definition of infertility, women under 35 try for a year, over 35 try for, 6 months. But the most important thing is timing. Because if the timing is not right, you kind of miss that whole month. And now you got to start over the following month. So those two words are really, really important. Time and timing. And don't be frustrated if it's taking 3 months or 4 months. I have some people come to see me, they're in their early 30s. And they say, well, we want to make sure everything's okay before we start. And I said, well, that's a beautiful
Okay.
thing. Let's make sure everything is good. But I have to remind them that no matter what the test results show, it doesn't mean that you can't get pregnant. And there may be a lot of people walking around that have some issues that we don't know about, but they get pregnant and have children. So the one thing is just understand your body. Understand your body. Know when you're ovulating. And now, if it's been a while since you've been trying to get pregnant, go see a specialist. And that specialist doesn't have to be a fertility doctor. That specialist should be a gynecologist,
Mhm.
because they're the first line of defense to kind of say, let's do some initial testing to make sure everything's okay. And then if you see something that's more involved, then we'll refer you to a fertility doctor. So 'cause I think it becomes very stressful if you're just starting out and trying to make sure everything's okay. You go to the fertility doctor and you get you see all the other things. You see women coming in out of the office. You see, they start doing ultrasound. It becomes a whole stressful thing instead of starting with your gynecologist, where you feel comfortable with, get that testing done, and now get referred to the fertility doctor if you need to.
When you say testing with your gynecologist, what are some of the common tests that happen at that stage if you're, like you said, just getting started?
Yeah. The first step for every gynecologist to do is to take a history. Okay. But there's a lot of things just by talking to a patient you can diagnose. You know, there are some things that they may have a sexual dysfunction issue in the relationship, and that's why they're not getting pregnant.
Hmm.
A woman could say, you know, I got this discharge that's coming from my breast, and that's something that could make her periods irregular, or she may not have periods at all. May not be ovulated. So there's simple things that a doctor can get by just talking to the patient. You know,
Hmm.
making sure periods are regular. Um, when was your are you having any discomfort when you have intercourse? Do you have discomfort when you have your menstrual cycles, such as endometriosis? So a lot of different things that you can start off with by a history. But then we started doing some diagnostic testing.
Hmm.
And basically, there's four things that we want to assess. The first is I call ovarian reserve, or what is your egg reserve like? The second is the sperm. The third is, are you making an egg every month? Are you ovulating? And then the fourth part is, are your tubes open? You know what's interesting? A lot of people don't know that in order to conceive, the egg and sperm meet in the fallopian tube. A lot of them have no idea. You say the fallopian tube, a fallopian tube, what's that? So I have my handy dandy diagram on my desk. I say, look, this is how you get pregnant naturally. This is the fallopian tube, and the egg comes here, and the sperm goes there, and you go, oh, I didn't know that. You know, it's very complex to get pregnant. Yes, it's very complex to get pregnant.
Oh my gosh, I love it. It feels like we all just need to go back and take, go back to biology, go back to high school where we were all just, just start over.
You know, two things: learn your biology, and number two, stop working so hard. Oh my goodness, I got. And you know, it was interesting that the couples who are trying to get pregnant, they always work very late, or one person working during the day, and then the other person working at night. By the time they both
Mm.
get home together, they're both tired, and so you know, this is one of those things that you have to say. Look at your whole lifestyle. You know, is there something I can change in my lifestyle to make sure that we're together at the time that I know that I'm pregnant?
Yeah. Speaking of lifestyle, I mean, we hear a lot about cortisol levels, or you do kind of always hear the old adage of, oh, the minute that I stopped trying, all of a sudden I was pregnant and things like that. What are maybe some of just those lifestyle changes or just things that need to be assessed whenever you're wanting to try and get pregnant and you're looking at your fertility?
Yeah, I would say, you know, lifestyle changes. Number one is that people always do things in moderation. You know, like you mentioned, hey, you love your coffee. You know, if you love coffee, have coffee. But look at your overall caffeine intake, because if you have a cup of
Sure.
coffee, you have a soda, you have some tea, the caffeine levels go up, which can interfere. You know, things that are obvious, such as smoking. Just make sure you know your body, and make sure you take a good multivitamin. You want to take your prenatal vitamins, because you want to be prepared. So when you do get pregnant, you have the right vitamins levels in your system. Just basic things like that. But the key thing is that no, you will get pregnant. It takes time to get pregnant. You gotta have sex at the right time. For some patients, it is very difficult to get pregnant. They do have issues that the fertility doctor needs to take care of. But for a lot of women, it's little things that you make a little adjustments, and give yourself a little time, and you will be successful. And time is so important, because I always see a lot of couples and I say, I think you should try longer. And the reason why I tell them that is because with fertility treatment, we try to speed it up, but
Hmm.
we're really not able to speed it up. Our first line of treatment is something called inseminations, or IUIs. Okay.
Right.
And even for women who are in their early 30s, it may take about 4 or 5 months before the majority of those women get pregnant. And the big issue is that they will get frustrated after the second month, after the third month, and they'll stop that treatment and say, well, this is not working. I need something else. And next thing you know, they're IVF. So whereas if they would have just tried maybe 4 to 5 months along on their own, maybe they'd have gotten pregnant. But by the time you come to fertility specialist, everything gets sped up. If the first two
Mhm.
or three IUIs don't work, next thing you know, you're doing IVF where you may not really need IVF.
Yeah. Well, but again, I think you're tapping into something that's so important is that it does feel like time seems to always be the the enemy of fertility. You talk to, everybody wants to go fast because, oh gosh, we've been doing this for so long, whether they, are working with a surrogate or an egg donor or just themselves. And I think you're right. It's all relative at the end of the day whenever you do end up getting that result that you're wanting. It just is going to take some time and maybe eventually a readjustment for sure, but like you said, time, it's so important.
It is. So time and timing. See, you got it. Time and timing. Two most important
Time and
words.
timing. One thing, it feels like fertility preservation is becoming more and more common. I think, to maybe take the stress out of that, quote unquote biological clock and, just things like that. And so that preservation is happening even outside of a medical diagnosis. What would you say are maybe just, again, myths or misconceptions or things to be aware of that you would love to clear up?
Yeah, I think first of all, egg freezing, one of the biggest advances for women. It's a major advance. I mean, it's just fantastic. Okay, but it has its pros and cons.
Hmm.
One of the things, as far as the disadvantage, is that it is an expensive type of treatment. A lot of people think insurance will cover it, and sometimes their insurance will say, "Oh yeah, we cover egg freezing," but then they realize it's not for social or just preservation. They may cover it just because need to have a diagnosis of cancer or some other type of treatment that's going to take away your fertility before they recover it. So, the stressful is the cost. The myth that, egg freezing is affordable. Uh, I believe in New York City, the average egg freezing cost is probably about $8,000. But then you have to add in the medications, which may be another $2,000 or $3,000. So it is a very expensive process. It's once again, it's great. I think everyone should freeze their eggs. However, um, there is a thing I worry about the most is that when women freeze their eggs, there's this false sense of security. In other words, I can
Mm,
freeze your egg, but I don't know if it's going to turn into a healthy embryo in the future. And some women will freeze their eggs and get this comfort level that, oh, you know what? I will wait another couple of years to try to get pregnant. And then they're in their 40s and say, you know what? I'm going to fall back in my frozen egg, which is fantastic. That's what they're there for.
sure.
However, if it doesn't thaw very well, doesn't lead to healthy embryos, I've seen a lot of patients that will come in and they're 42, 43, they froze the eggs when they were at 35, 36. And those eggs may not be healthy. They may not eat the embryos, or they may not get pregnant with those frozen eggs. And now they're trying to conceive of eggs that are 42, 43 years old. The best way to preserve fertility is to freeze embryos. However, you need sperm. Okay.
Sure.
And a lot of women don't like the concept of using donor sperm if they don't have a partner. And then even if they did have a partner, who knows if that commitment's going to be there in the future and not be free eggs with the partner, freeze embryos with the partner, and you guys break up in the future. Now the partner has to agree that, okay, you can use those embryos that we create together and get pregnant. So that's difficult. Those are two difficult things. So, the best way is to freeze embryos, but as far as like, worrying about if I freeze the embryo and I meet a partner in the future, what about those eggs? I always tell people you have the eggs you make, freeze them, and the other half you can create embryos. You get the best of both worlds.
Got it. Got it. It's a lot to think about. It really is. And I think I mean, that's definitely I think you're so right. I think a lot of people, do whenever they think about that fertility preservation, it feels like, oh, freezing eggs is the golden ticket. But like you said, there's so much to think about in terms of what happens after.
It's important that you assess your fertility at all ages, but that doesn't necessarily mean you have to act upon it. So
Hmm.
if you're 28 years old, you should start thinking about my fertility. Even though at 28, no one's thinking about that, but you should start thinking about that. Speak to your gynecologist, get a test called an AMH, anti-malarial hormone, which lets us look at your egg reserve. But you have to understand what that result means is that it has nothing to tell us if you will get pregnant or not. It's just a
Hmm.
moment in time of what your reserve is like. There are a lot of people who have a low reserve of eggs or low AMH that have children. So don't think that because your AMH level is low, that it means that you're not going to have children. And don't think that your AMH level is high that you will have children because it's just looking at your eggs at a moment in time.
Right. Right. One thing that I think is really interesting is, as you're going through the, fertility roller coaster, I like to call it, when you do eventually, if you do eventually get to the IVF process, a lot of times I feel like IVF is kind of portrayed as this sure thing or like a one size fits all solution. Can you walk us through just maybe why outcomes can vary so much from person to person?
Yeah, I mean, the one thing that we have to realize about IVF is that we've come a long way. When I first started in the fertility world in the 90s, I mean, success rates like around the 25%. And now that we learn more and more about
Wow.
embryos, fertilization, the success rates have increased, but they're nowhere near 100%. Like even in the ideal scenario, if I take a woman who in her 20s, that the sperm is very healthy, and the only reason why they're doing IVF because their tubes are blocked, that maybe a 65% live birth rate, nowhere near 100%. And we just don't know what makes an embryo implant. That's our biggest dilemma. We can look at it, we can see if it has the right chromosome makeup, but we don't know if it has the right mechanism to implant. And I'm hoping that even my kids don't want to be doctors, but I'm hoping that maybe a few generations down the road, some great 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 grandchild of mine will say, you know what, my great 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 dad was pretty cool, became a doctor, and they decided to become a fertility doctor, and they will look back at what we do today and say, oh my God, they were cave people. They didn't know how to do this test or that test to identify the healthy embryo. But that's the main reason why we just don't understand what the embryo implant. We can get eggs, we can fertilize eggs, we can see if the eggs become embryos, but we're just observers. We only tell you this is what your embryo looks like. It looks like
Mhm,
other embryos have the best potential to lead to a healthy baby, but we
mhm.
can't say for sure if it will lead to a healthy baby. It's success rates are nowhere near 100%.
When patients are asking about success rates, how do you help them understand that data in a way that feels honest but not discouraging?
Yeah, that's a tricky thing to do because a lot of women don't want to be discouraged when they see what their real outcome looks like. But the best way to do it is that there are, patient predictors based upon IVF, and start.org has a patient predictor based upon your information, your diagnosis, your AMH level, and it would give you an idea of what your live birth rate would be with IVF. And I do that for every patient that I see. And that's not to discourage them, but just to be realistic about it. Because
Mhm.
most people come in thinking that their chance is going to be 80, 90%. But then when you put their data in, they realize, oh, wow, it's not as successful as I thought it would be, which means that I may have to do this a couple times before, I am successful. So it's good to get that information and not be afraid of it.
Right, right. With more information, you're able to do a lot more for sure. For
Yeah.
some families, part of their journey is going to include either donor eggs or donor sperm or a gestational carrier or all of the above. What do you feel like are some of the most common misconceptions you see come up, maybe either emotionally or medically, around when these options are brought to your patients?
Let's start with donor eggs first.
Yeah.
For women, a donor egg, it feels like they're giving up on themselves and they feel
Mm.
defeated. The thing I do the most is, well, I don't want to do a donor egg because it's not my baby. And I said, number one, it is your baby because we're just gonna make an embryo, and we're gonna put that embryo into your uterus. You're gonna get pregnant, okay? You're gonna be excited when somebody says you're pregnant. You're gonna get nauseated. You're gonna take medicine for nausea. You're gonna get a big belly, and you have to get different clothes, and you're gonna go through labor. You're gonna ask for epidural. Hopefully, you ask for epidural, but you're gonna go through either a natural delivery or a C-section, and at the end of the day, when you cut the umbilical cord and that baby is laying on your chest with skin to skin bonding, that is your baby. And then when they see the big picture, they start to realize, you know what, that will be my baby. And they kind of come to terms with it. But, it's very difficult sometimes to, discuss donor rates with patients because they're just not ready for it. And, I always say that the window with your eggs, if it is open, is very narrow. Okay.
Mhm.
However, the window with the other eggs is much wider. So try your eggs until you say I have closure. And then once you have that closure, you always fall back on the donor egg. What's interesting about that is the intended parents have the same fears as the surrogate. So
Sure.
they asked me, they said, the parents, well, how do I know she's not going to try to keep my baby? And I say, listen to me. She's worried about how do I know they're not going to come and get this baby. So you
Right.
both have the same fears. But that's the biggest fear that people worry about for surrogacy. But you know what? It's important that they educate themselves, know that not every state in the U.S. is surrogate friendly. There's different laws in each state. And then you go into a contract with a surrogate. And the most important thing is not the surrogate baby, it's your baby. Because nowadays everyone is doing gestational carriers, where the embryo, the genetic material is not from the actual surrogate. It's from
Right.
either the intended parents' genetics, an egg donor or a sperm donor. It's not from the surrogate, which makes it not her baby.
Yeah. No, exactly. For for someone who is listening and feeling overwhelmed by all of the information that they're either finding on Dr. Google or message boards or just all of those things, where should someone start?
Well, I think the first place that you start is knowing yourself, knowing your body. We talked
Yeah.
about knowing when you ovulate, knowing the best time to have intercourse.
Mhm.
And then start with your gynecologist, do some routine testing to make sure everything's okay.
What's one question that somebody could ask their provider that would bring immediate clarity to them as they were getting started on their fertility journey?
Wow. I would say That's a very good question. Usually I don't have to think about questions, but that's a very. I mean, I'm thinking, what if someone were to ask me one question they can ask? I would say, is anything in my history suggested I may have difficulty getting pregnant? Or should I
Mm.
start earlier? Can I delay my fertility? What do you think, doctor? And that kind of get the doctor to start talking about her age, her egg reserve, and just answer a lot of different questions just with that one little question.
Yeah.
What do you
No.
think? It's a very good question, and yeah, I mean it's just not it's not one thing. It's when women are deciding to get pregnant, they have to make sure their partner's on board. I'll be honest with you. I have three daughters, and I do have a son, but I have three daughters, and I'm a strong advocate for women. Okay, and I will definitely tell a patient sitting in front of me when it sounds like this guy's not on board with her getting pregnant. I say, what? There are plenty of other fish in the sea. Okay, and if he's not on board and your biological clock is ticking, that means he may not be the right one for you, and maybe not. Maybe you may not need to go find somebody else because you're in love and that. But if there's no ring on your finger, there's always a donor sperm bank that you can get pregnant with. So make sure you find a partner that's on board with your goal. Don't go to his goals because you know he'll make sperm for many years. It may not function as well when he's younger, but he'll
Sure.
be able to maintain this fertility where your fertility will be lost.
I love the honesty. That's beautiful. You
Yeah,
have helped.
I say that because
Go ahead.
the reason why I say that is because it literally breaks my heart when I see a woman in her early to mid 40s when I'm telling her, we're not going to be able to do anything. The chances are 1% or 2%, or you're going to need a donor egg because
Mhm.
telling a woman like that is about her fertility, in my opinion. I'm a cancer survivor, so I think I can say this. Is that it's worse than telling someone they have cancer.
Mm.
Because if you tell someone you have cancer, the first thing they say is, "I'm going to beat it. I'm doing everything I can possible to beat this." But when you tell a woman that she's lost her ability to have her own child because her eggs aren't healthy, because of her age, a lot of times the women don't recover from that. And it breaks my heart to have to tell somebody that and realize that I can't offer them a tool that will make their eggs better. If they'll say, "Doc, what can I do to make my eggs better?" And there's nothing that we can do to make those eggs better, to improve your chances. I mean, there's things out there that people try, supplement, but there's nothing that we all agree upon that can make those eggs better. And that woman who's in her mid 40s who wants to have a baby and can't.
Yeah. What when you're in situations like that, and I mean you've helped so many families. What still gives you hope every day?
It's it's a being a fertility specialist is an amazing job. It's a very stressful job.
Sure.
Because it's sort of, I don't know if you like baseball or anything like that, but a good batting average in baseball is if you strike out, you know, 7 out of 10 times, right? So if you get three out
Right?
of 10 hits, 3 times the bat, you get 3 hits, you're doing really well. But our numbers overall are pretty much like that overall for success. Probably about 30% overall. That means that there's 7 women out of 10 who you weren't able to help.
Hmm.
But there's always that one person that comes in and reminds you that we do this because we love what we do.
Mhm.
Even though there's a lot of stress to it, even though not everyone's going to be successful, I tell myself is that my job is to help you across the fertility bridge. And the fertility bridge is where you're just starting off and you cross it, either having success, having a baby, or think about other reproductive options such as adoption, egg donation, surrogacy. My job is help you get across that bridge and not let you get stuck in the middle. Because a lot of women were stuck in the middle and don't know how to cross that bridge and have difficulty and never get over the pain of not being able to have their own child.
Mhm. What is one message that you would want every listener, especially those maybe early in the process or feeling unsure, they're stuck in the middle of that bridge? What's one thing you want everybody to remember in their fertility journey?
Hmm. Always dream and dream big.
Mm,
Never give up. Always dream that you're gonna have the family that you want, and then go about the way to obtain it. Now, having a family not may not always be how we dream we would have a family. So sometimes we think about donor sperm, donor egg. You're working with a surrogate, but at the end of the day, you're still going to get to the outcome of that's your child, no matter how you conceive it with your eggs, a donor egg, donor sperm, or surrogate. That's still your child. So always dream. And number two is listen to your body. Don't listen to everybody else. Listen to your
mm,
body and understand when you're able to get pregnant. Understand when you're fertile, and don't be afraid to go to the doctor. A lot of times, people, particularly women of color, they put it in God's hands, and I think everything should go to God's hands. But God gives us technology to help us help women who are having difficulty. So if you're having difficulty getting pregnant, go see a doctor. Don't be afraid. Um, find out what's going on. Maybe there's nothing going on and everything's normal. It just needs a little bit of time, but definitely don't be afraid and see a doctor. Dream big, and you'll be successful. It may not be the way you always dream that you're going to be successful, but you definitely will be successful.
I love that. And I love that message of hope. I have one last question for you, and it's a fun one. As you know, we've already discussed
All
it.
right.
Me and coffee, we are best friends. I'm never far from her. And so I always love to ask the question, what has filled your cup today? Literally or figuratively, what has been the thing to that has filled your cup?
Oh wow, that's a very good question. You mean like the whole day, or you
You pick.
know, if it's the whole day? Let's just say the whole day. Let's say the whole day. What filled my cup is number one is that I have an amazing staff, and
Mm,
coming to work is not like work; it's like family, and we all have the same common goal is that we just give our best to the patients that we take care of. And
mhm.
I would say that my cup was filled today, and that I guess the best thing that ever happens is when people bring their babies back, And
Oh, for
today I had
sure.
a special visit from someone bringing the baby back, and just the whole. And just so you know, my wife hates it when the babies come back because I always come home and say, you know what, we should definitely have another. She said, "Oh my God, you held another baby today." I said, "Yes, I held another baby today." So let's think about having another one. So she hates when it happens, but I love when it happens, and it just today was a special day because somebody did come in, and it was very cold. You usually don't see babies in the winter because parents don't want to bring them out when it's cold. So
Sure.
baby visiting time is usually early, the springtime, summertime. But I was surprised by a visitor today, and it was very very special. So that's
I
what filled my
love
cup
that.
today.
I love that. I'm with you. I'm loving anytime I get those baby pictures or, little cards or things like that. I think my husband's in the same boat as your wife because I'm always like, "Oh, but look." And he's like, "No, stop. No, put it away."
Yeah, yeah, no, that's not happening, right? But Whitney, I have to tell you, there's things that are happening now that are making me a little nervous. And in the beginning, you get the baby pictures, next and that, and you start getting the middle school pictures, and then you get the pictures that graduate from college. I am now getting pictures of women who were conceived via IVF, and now they're having babies. So now I'm facing my own longevity. Should I retire at this point in time? And I don't want you, the great grandbaby, say, hey, my mom had me. This is now
Oh
my
my god.
son. This is his son or daughter. So, you know, it's getting to
I
that
love it.
point.
That's a
I can start
legacy.
thinking about retirement, but I love it so much.
Absolutely. Oh my gosh, that's amazing. Well, again, just thank you so much for your time, your insight, and just the obvious just care and love that you bring to this work. I am just so grateful for this conversation and all of your words of wisdom, and just everything. So thank you so much, Dr. Thornton.